Hello people, in this video we want to look at pre-malignant lesions of the skin. Okay, so basically what are we talking about the skin? So there can be some benign conditions and malignant conditions. In between you can have some pre-malignant lesions. That means it is going to further lead to malignancy. So that is why they are asking you what are the pre-malignant lesions of the skin. Okay, so the pre-malignant lesions of the skin are as simple as this. Just say chronic irritation due to dyes, etc. Then solar keratosis, right? Because of prolonged exposure to the sun, there can be hyperkeratosis, etc. If somebody is taking phototherapy for treatment of some skin conditions, that can lead to carcinoma, right? Then the third thing they're telling here is chronic scar, right? And that can lead to Marginalised ulcer. How do you pronounce this? Yes, guys, it is Marginalised ulcer. So whenever a person has burns, okay, a burns scar, that can lead to a Marginalised ulcer. What is this? A squamous cell carcinoma which develops in scar tissue. Okay, a squamous cell carcinoma which develops in a scar tissue is called as a Marginalised ulcer. So scar, chronic scar can lead to malignancy. Kindly also note that the scar may not just be because of burns, it can be because of so many other reasons like the varicose ulcer, snake bite scar, chronic osteomyelitis scars, lupus vulgaris, etc. That is tuberculosis of the face. They are saying so many types of scars that can lead to squamous cell carcinoma in the scar tissue, that is called as Marginalised ulcer. Okay, scar, squamous cell carcinoma, this is called as Marginalised ulcer. Here they are showing you the Marginalised ulcer arising from burn scar. But remember, this is a malignant condition, Marginalised ulcer. Okay, they're here in this question, they're asking you the pre-malignant lesions of the skin. So here you will say chronic scar, which will lead to this Marginalised ulcer, which is the malignant condition. So you are supposed to see the pre-malignant condition is the scar, chronic scar. We are looking at the pre-malignant conditions of the skin. So we saw chronic irritation, then sun exposure, hyperkeratosis, etc. Then we saw chronic scar. Now let us go on to four more are there. Okay, look at this. Dermatitis, Bowen's disease. Okay, then I'll give you the other two, Leukoplica and autosomal recessive disorders. So these four are left. Let's look at these. Okay. Now, look at this dermatitis. People who work in radiology department, right? They're so much exposed to radiation, right? What changes will be there in their skin? They may have some simple erythema, atrophy or hyperpigmentation. Then later it will go on to become squamous cell carcinoma. So they should be very careful. They should wear protective gear, etc. Right? Radiology department, whoever works. Okay. Now let's go to the fifth one, Bowen's disease. So guys, how is it going? Is it too much? So we're looking at the fifth pre-malignant condition of the skin, Bowen's disease. Look at this image here, guys. It says here Bowen's disease. Here they have mentioned it as a pre-malignant condition. To me, suddenly when I look at this, I would say it's melanoma, but they're saying it's Bowen's disease. Let's wait and understand. This is yet another picture of Bowen's disease with ulcerated squamous cell carcinoma. So now there is carcinoma here, squamous cell carcinoma. So basically what they're saying is if there is chronic solar damage or inorganic compounds, again chemicals, or if there is because of human papilloma virus, there can be some skin changes, okay, skin lesions, scaly erythematous plaques, which are multiple, brownish patches with raised margins, okay. So finally what will happen? This will become carcinoma. So Bowen's disease is a pre-malignant condition. Though the sentence says it is carcinoma, it is actually pre-malignant. That's what they're trying to say here, isn't it? The whole topic is pre-malignant. Okay. So they are saying for this, the topical application of 5-FU or imiquimod is an effective treatment. Okay. So look at this image here. This is 5-fluorouracil, 5-FU. So they can give all this for this condition. Okay. Then coming to Leukoplica, this is very important. Leukoplica you have seen in oral Leukoplica, etc. Right? So basically, if you cannot rub it off or you cannot classify into any other disease, etc. We have also seen this in larynx in ENT, right? So it's a pre-malignant condition. Remember, it's marked here also as pre-malignant condition. So basically, it can become carcinoma. In that, you have two types. You have the hyperkeratotic leukoplakia and the dysplastic leukoplakia, two types of leukoplakia. Just remember, don't get confused with hairy leukoplakia, which is seen in AIDS. That will never become carcinoma. Okay, we are not talking about that. Okay, so where are we here? Pre-malignant lesions, hyperkeratotic leukoplakia, dysplastic leukoplakia, etc. So where is it? Cheek mucosa, floor of mouth, etc. We're talking more about the oral cavity here. So because of tobacco, alcohol, ill-fitted dentures, any irritation. And what will you see? So they're talking about, guys, focus, 5 millimeter, more than that it should be there, diameter, circumscribed, slightly elevated, etc. Then coming to the histology, we told you there'll be hyperkeratotic type where there is hyperkeratosis, hyperplasia, etc. Dysplastic type where there is irregular stratification, abnormal mitotic figures, epithelial dysplasia, etc. So here they are talking about the hyperkeratosis type, and here they are talking the dysplastic type. You can see a lot of dysplasia, isn't it? Here you should be seeing hyperplasia. Last one, guys. So what and all have we seen so far? Let's just revise off it. We saw chronic irritation, sun, then we blamed chronic scar like Marginalised ulcer can happen. Then you saw the fourth one, then we saw Bowen's disease. Then recently, what did we see? Why am I forgetting? Radiodermatitis for radiologists. Okay, then Bowen's disease. That is the fifth one here. And then you have the Leukoplica, which is the sixth one we have seen. And the last one that we will see, autosomal recessive disorders, very important here. Xeroderma pigmentosum, albinism, they have an increased predisposition to skin cancer. So basically what these people have, some autosomal recessive condition, is it? Let us look at this. This is from the pathology textbook. If you see pre-malignant conditions, the same thing, but just few examples like solar keratosis, Bowen's disease, xeroderma pigmentosum, erythroplasia of Curat. All this we have learned in skin, right? Erythroplasia of Curat also, you can remember that. So now look at xeroderma pigmentosum, is it? You should remember this, guys, pre-malignant condition. So basically it's a skin disorder. It is autosomal recessive. Guys, it is recessive. That is good. So it's a pre-malignant lesion. It can lead to squamous cell carcinoma, basal cell carcinoma, melanocarcinoma, etc. What do you know about it? Sun-exposed skin is more vulnerable to damage. UV radiation, etc. will damage, and the body does not have the ability to repair this damage. This is what is so important you're going to see here, that in xeroderma pigmentosa, there is no capacity of the body to repair it. Okay, wherever we here. Okay, then. This is hypersensitivity. Okay, due to this gene, the recessive condition only, but it is autosomal recessive, but it is, what am I saying? It is more prone for damage and it doesn't have the capacity to repair. So what will you see in these people? Hyperkeratosis, thinning and atrophy of the stratum malphagi. Where is stratum malphagi, guys? Looks like the stratum spinosum and the stratum basale together, they're calling as the Malphagian layer. This is what is affected in the xeroderma pigmentosum, right? So what are they telling here? So there is thinning and atrophy of the stratum malphagi. So the stratum malphagi, those two layers together are very thin, atrophied, okay? There is irregular accumulation of the melanin in the basal cell layer. There is infiltration of the cell there is chronic inflammatory cells are there. And this can convert into cancer in advanced stage. Okay, so what did you understand? The Malphagian layer, atrophied and thinned, etc. The basal layer is what? Having, what did I say? Where are we here? Guys, focus. The basal layer, what is happening? Accumulation of melanin, and that is irregular, chronic inflammatory cells, etc. And then it will become carcinoma later. Okay. So pre-malignant conditions of the skin, what and all you saw? Solar keratosis, Bowen's disease, then at xeroderma pigmentosa you saw. What else? Guys, another condition they have mentioned here is albinism. These people also are predisposed to skin cancer. So what happens in these people who have albinism? They are predisposed to squamous cell carcinoma. So here there is melanogenesis is affected, right? So there's no production of the pigment melanin. There is no problem with the melanocytes, if I'm not wrong. Basically, the problem is with the production. Melanogenesis is the problem. And this is condition where the entire body is affected, isn't it? Unlike vitiligo, etc., where there's patches which are affected. So guys, did you understand exactly what we have tried to look at in this video? We wanted to look at the pre-malignant conditions of the skin. So basically, what are the pre-malignant conditions of the skin? What and all did you see under pre-malignant? So under pre-malignant, you saw chronic irritation. Very good. Then you saw solar keratosis, chronic scar, dermatosis, right? Then you saw Bowen's disease. Then you saw, what was the last but one? And last one I'm sure was the autoimmune condition. And there was one more, Leukoplica. Very good.